you asking a question, making a comment, or contributing to the discussions that are ongoing. I would also prefer that before you ask a question or you make a comment, any suggestions, you put up your hand. And when you are given the opportunity, you start by introducing yourself, your position within the organization, and then also your organization and what your organization stands for. And the last ground rule that we would want to propose for your taking is to respect the views of all participants on this calls. Questions, comments, suggestions, anything that your fellow participants are making, you should exercise patience to accommodate them. Thank you very much. Leila?
Thank you, Lawrence. Okay, so for the next item now, what we're going to do is we're going to run through a overview presentation covering what we hope is the key information that you will need to prepare any application. So it's to inform you about the call for proposals, the eligibility and assessment criteria, and some key things that we'll be looking for. Now, Lawrence is going to take you through the bulk of that presentation, and if we could just ask for your patience to maybe hold your key questions to the end. We've scheduled quite a lot of time for questions and answers. But if we could go through the presentation first, hopefully that might answer some of your outstanding questions. So back to you, Lawrence.
Okay. Thank you so much, Leila. And so we begin our today's information session by looking at our calls for proposals that was sent out to you individually and also in the media. This presentation would cover these areas. This is not exhaustive, but as and when you have further questions, this could be addressed at the tail end or per the email address that is indicated in the calls for proposals. So we'll be talking to you about the background to this program. What is the context that we are looking at? Why we are calling for this proposal and the launch of the proposal, calls for proposals, the objectives, and then the priority focus, the grant principles that will guide the engagement of you as grantees. Hello, can you see my screen? Sorry, I didn't ask before launching into presenting.
Can everyone see my
screen?
Not yet, Lawrence.
Oh, sorry.
That's okay.
Not yet. Not yet.
Okay, 1 second. Sorry.
That's great. We can see it now. Can you go into presentation mode? Wonderful.
Right. Yes.
Thank you so much.
Okay. So sorry that the screen wasn't showing. Yeah. So just to continue from where I left off, we're just looking at the context or the presentation outline, and so we'll be looking at the background to the program, why we are calling for these proposals, the objectives and then the focus of these calls, the granting principles that will guide the award of this grant, the scope and eligibility criteria. We would also be discussing what we would fund and what we will not fund. Summary of the key grant information will be some information that we will share in this presentation. You will also be taken to the key assessment criteria. Frequently asked questions, some have been envisaged and answered here, but you are welcome to ask more questions. How to apply for this grant, and how to navigate your way through the downloading of the application package. We would also provide you with additional information. We'll share with you the monitoring, evaluation, and learning strategy that we put in place for this grant. We'll also talk to you about the governance structure for this grant, resource availability, and finally, we'll come back to you to ask for your comments, your questions, answers, and other suggestions that you may have to enrich the process. So the program, Ghana Somubi Dwumadie, is run by Options and supported by consortium partners, Basic Needs, King's College of London, Sight Savers International, and Tropical Health, which will focus on these key areas. One will be promoting stronger policies and systems that respect the rights of people with, part of the distance, that will respect the rights of people with disability, including people with mental health conditions. We would also scale up high quality and accessible mental health services. The program also looks at reducing stigma and discrimination against persons with disability, including people with mental health conditions. And the final key area that the program will look at will be generation of evidence to inform policy and practice on the effectiveness of disability and mental health programs and intervention. And this is funded by a UK aid from the UK government, and it's a 4-year program. The context that guides the implementation of this program is listed here for your following: the Ghana Disability Act of 2006, the Mental Health Act of 2012, Inclusive Education Policy 2016, and the Mental Health Policy. Implementation of these various acts and policies are challenging due to the under-prioritized nature and under-resourced nature of the issues of disability, inclusion, and mental health. Limited budgetary allocations, of course, government allocations for disability, inclusion, and mental health. Non-enforcement of the disability laws and rights, giving rise to discriminations. If you read through the Disability Act, the Mental Health Act, Inclusive Education Policy, and Mental Health Policy, you see that there are very good policies and laws there to protect the rights of persons, to protect the rights of disabled persons and mental health, but these are not being adhered to. Then also we have governance challenges at the implementation level. The social protection programs are not comprehensively addressing the disability issues. Mental Health Authority and National Council on Persons with Disabilities have limited resources as well. Hence, the complementary role of civil society is very crucial, and that is where you come in. What is the change pathway that we're looking at? We're looking at the awarding of grants to civil society organizations for right participation, advocacy, accountability, and stigma reduction. This, of course, will definitely lead to these 4 areas of outcomes that is expected of the program. We'll look at grants for evidence-based approaches to improve integration and accessibility of mental health and social services. We're looking at grants for social behavioral change communication and stigma reductions. We're looking at grants for user-led advocacy initiatives, grants for studies, operational research to improve the effectiveness and if evidence-based of interventions, in particular, community-based rehabilitations. When these outputs are achieved, we expect that the outcomes that would come with it would be quality disability inclusive mental health treatment and rehabilitation services are sustained. People with disabilities, including mental health disabilities, are empowered and their rights are protected. And the overall impact will be all persons with disability and health disabilities are engaged, empowered, and able to enjoy improved well-being, social and economic outcomes, and rise. Laila, you want to add something to the change pathway, or should I continue?
I think you've summarized it beautifully. I think the only thing to emphasize will be that in that very first blue box, the grants for evidence-based approaches for mental health and social services, this is where today's call for proposals is sitting. So if you can visualize the overall approach to granting, the call for proposals that Lawrence is going to take you through now is very much focused on that first area. We're not looking to address the other areas with today's call. We'll be addressing those with future calls. So back to you, Lawrence.
Thank you for that, Leila. So why are we calling for these proposals? Within Ghana and globally, there are reports of increasing mental health impact as a result of COVID-19. The World Health Organization has outlined some key examples. This includes the elevated rates of stress or anxiety, the elevated levels of loneliness and depression, neglect and abandonment, possibly due to caregivers being unable to fulfill their roles, increase in harmful alcohol and drug use, self-harm or suicidal behaviors are also expected to rise during this period. Domestic violence is not left out. So within Ghana, mental health impacts includes the stigmatization of people who have recovered from COVID-19. We've all been hearing in the news how persons who have recovered and discharged from the hospital are suffering stigmatization and discrimination. Healthcare workers are another group who are experiencing elevated stresses. People with disability, including mental health disabilities, are disproportionately impacted due to attitudinal, environmental, and institutional barriers. This is why we're calling for this proposal. The grant strategy for the program was launched yesterday, and this was carried in the Daily Graphic and the Ghanaian Times as well. You have the photos as the extracts of this there for you to look out for. The page numbers are indicated, page 20 for the Ghanaian Times of yesterday, and page number 52 for the Daily Graphic. The closing for this calls is on 14th August 2020, not later than 5 p.m. It's very important to take note of the cut-off point or the deadline. What will be the objectives and the priority focus of this program? The specific objectives of this call would be to support those at risk of negative mental health outcomes due to the pandemic, to support at-risk groups with recovery and resilience building, to encourage community groups to lead efforts embedding mental health support within the communities, to complement information, economic and other social measures by the government of Ghana and stakeholders. The proposed interventions must be of benefit to one or more of the following key priorities population who are likely to experience additional mental health stresses due to COVID-19. 1, people infected with and or those who have recovered from COVID-19. 2, healthcare workers and their families. 3, people with disabilities and or existing mental disabilities. These are the targets populations that we'll be looking at under this priority focus. What will be the principles that will guide these grants? This calls for proposals that we aim to award between 3 and 5 grantees. Number one would be that we expect this to be participatory in nature, nothing about S without S. The grant will only be given to projects who clearly demonstrate a participatory approach involving people with disability or mental health disabilities. Oftentimes, majority of us or some of us would sit in our offices and develop our proposals without getting the beneficiaries, the side of the beneficiaries incorporated into that. Two, we'll be looking at knowledge building, share learning with partners, stakeholders, and the wider sectors to support meaningful change. Grants will be used to promote a culture of learning and sharing among grantees. We also expect to see some level of collaboration, where it will be a regularly structured occasion for collaborative review of grant progress and achievement, and the participation of the grants targeted participants would be encouraged. This speaks to the first bullet, which talks about the participation also. Then we'll also be looking at adaptability to the evolving disability and mental health policy. Even the virus itself that we are looking at, coronavirus, they say it mutates, it keeps changing. So the name of the game will be adaptability, how you can quickly adapt to accommodate this on board. What we will consider funding. So we would consider funding this below. Mental health counseling initiative for people most affected by COVID-19, including staff working in healthcare organizations who are faced with increased stress and anxiety due to the increased demand brought on by COVID-19. So intervention should be targeted at some of this. 2, burden system support initiatives. 3, provision of psychosocial first aid for target groups facing mental health stress. 4, community-led cycles of support for people most affected by COVID-19. 5, psychological helpline through community chat lines, providing mental health support to target groups. 6, initiatives that build the capacity of community leaders, including faith-based leaders, and to provide psychosocial support within their communities. What will we not fund? We will not fund the establishment of treatment centers. We will not fund logistical support for psychiatric hospitals. We will not fund general public education. We will not fund long-term bereavement support. We will not fund media sensitization or behavioral change, and we will not fund support for children. And when we talk of children, we mean persons below the age of 18 years old. This list is not exhaustive, but we also want to give you excluded activities, which include activities that do not meet the eligibility criteria that has been listed above. We also would exclude activities which may lead to civil unrest. This is illegal in every jurisdiction. We would also not fund activities which would discriminate against any group on the basis of age, gender, reassignment, disability, race, color, ethnicity, sex, sexual orientation, pregnancy, maternity, religion, or belief. This is deeply enshrined in the Constitution of Ghana and also enshrined in the Universal Declaration of Human Rights. We will not also fund activities that are not fully funded, that are fully funded by other sources, either in cash or in kind. And we can discuss more about this at the questions and answers session as to some of the costs shared or the costs that are shared within your organization. will not fund costs that have been incurred prior to a formal agreement being executed, including those associated with preparing bids or grant proposal. i.e., if you incur costs to participate in this and the grant is eventually awarded to you, we will not pay for the expenses that have been incurred to participate in this and other related costs. What is the amount and the duration of the grants that we're looking at for this call? The total grant call is approximately 700,000 Ghana cedi. Grants allocations will not exceed 200,000 per any given project. This does not mean that each project will receive this amount. Grants are capped at 50% of the organization annual turnover. So your organizational annual turnover will determine the amount of grant that will be awarded to you. Up to 15% of the grant amount will be eligible or will be accepted for you to use to fund your overhead expenditures. It is also anticipated that between 3 and 5 grantees will benefit from this fast-track short small grants program that will deliver the psychosocial support around COVID-19. The maximum duration for this grant would be 12 months. This slide summarizes the criteria and what is expected and the guidelines for the preparation of your proposals. We already spoke about the funding principles, which we indicated that we would only be interested in funding activities that are participatory in nature, that are knowledge-based, that is collaborative in nature, and that is adaptable to the circumstances that is being envisaged. What will be the funding approaches that will be used? We will be looking at inclusion and diversity management. We'll be looking at sustainability and value for money. Very, very important. Take note of value for money. I always tell grantees that DFID projects are synonymous to value for money. So if you want to implement a project for DFID, just make sure that you grab the concept of value for money very well, and you are prepared to exhibit it throughout the implementation of the project. We would also be looking at the do no harm and responsibility granting. We will look at robust management of conflicts of interest. Conflict of interest is a reality in management of organization. The important aspect of it is that what are the measures that have been put in place to ensure that this is mitigated against? What will be the targeted end users? People with disability, people with mental health disabilities, healthcare workers, people with COVID-19, people who have had COVID-19. And the eligible organizations are disabled persons organizations, self-help groups, women's rights organizations, other civil society organizations. The key financial details to keep in mind as you go about the development of your proposal. One is that this is a small grant and is up to a maximum of 200,000 per call for the 12 months duration. Two is that this is capped at 50% of your organizational annual turnover. Three is that up to 15% of the budget that you would develop will be allowed or eligible as cost towards your overhead expenditure. Three is that there is no match funding requirements under this. And then four is that it covers a duration of 12 months. What will be the key assessment criteria that the program would employ to review your proposals? Number one is that it must address the core objectives. 2, the proposed intervention must benefit at least one of the key priorities populations. We've mentioned the key priority population. You can see it in this slide here. People with disability, people with mental health disabilities, healthcare workers, people with COVID-19, and people who have had COVID-19. We would also want to see that your proposal demonstrate a participatory and user-led approach that involves the target groups that it seeks to support. We would expect to see that your proposal also demonstrate that the intervention is based on an evidence-based model of psychosocial support. We would expect to see that your proposal demonstrate a robust approach to safeguarding, in particular, safe and manage conclusions to the psychosocial support at the project end. We'll talk more about safeguarding as we go with this presentation. The applications should clearly show how it will deliver the project within the time frame of 12 months. The project must also represent a good value for money. The applicant's organization must demonstrate a strong track record of prior experience relevant to the development of the proposal. Frequently asked questions. We were looking at what are some of the questions that you may have that we've already addressed, and those that are not addressed yet will be asked at the end of the presentation. One is that, would children's mental health be a focus on this call? And our answer is no. Children under 18 will not be supported. Some disabled people organizations or self-help groups are informal by nature, without well-organized office and operational systems in place. Would they qualify for this grant if they present a strong proposal that meets the funding criteria? Our answer to this is, these kinds of organizations will be addressed, and when necessary, their capacities will be built to support the implementation of any grant to be awarded to them. In particular, the program would address their safeguarding needs and do no harm approaches in detail. If my application is rejected, can I reapply for other Ghana Somubi Dwumadie grants? The answer is yes. You can apply for a grant call again if not successful in this current call. Will I be contacted for more information? You must submit all relevant information with your application. An assessor may contact you to discuss your application in further details, either by phone or virtual, and will arrange a time that is convenient for you. Please note that this might not always be necessary or the case. How do you apply for this? The fast track or special grant processes. We already indicated to you that this grant is a fast track grant, and it's a small grant in nature. So this refers to an out-of-cycle call for proposals of a call for proposal which addresses an agent or newly apparently need, such as that may be caused by COVID-19. A fast-track process does not generally result in a faster assessment process. However, the application window is reduced to 2 weeks. The fact that we describe this grant as a fast-track grant does not mean that the assessment process of your eligibility criteria and other due diligence that may be associated would be fast-track process, in which case we may miss out certain important key key information that would help us to support you more appropriately. Note also that applications that are made through the fast track process would enter the standard application process and will be checked for eligibility and assessed against the criteria that has been set for all grants without exceptions. What are the key information for this call? This call was open as of yesterday, 29 July, and interested applicants can visit this website to download the application package. In the next slides, we'll take you through how to download the application package. We'd already stressed to you that the application closes at 5 p.m. on Friday, 14th August 2020. And no application will be considered after this deadline. Emmanuel, will you be able to take the participants through the downloading process, please?
Yeah, all right, that's fine.
Okay.
Yeah. So if you want to download the application pack, in the call for proposals, you will see the web link to the website, which is also displayed up over here. That's, you kindly visit the website. That's options.uk/rec/Ghana Participation Program. So when you click on the website, you see this page appearing. You can still go to the previous slide. You see this page appearing. You have a brief background of the program. On your right, you see that the call for proposals, as highlighted in yellow, is showing. So just click on the call for proposals written in capital letters. So after you click on the call for proposals, it will take you to another web page. You can go to the next slide. Yes, when you click on it, it will bring you to this page. It tells you the Ghana Somubi Dwumadie is excited to announce its call for proposals. Then at the bottom, after you see the publications, you see the call for proposals pack. So kindly click on the call for proposals pack as shown over here, highlighted in yellow. So once you click on it, automatically the application pack will be downloaded in a zipped folder by your browser. So once you click on it, it will be downloaded in your browser in the zip folder. Then you can open your zip folder and you see the contents of the application pack, which include how to apply, that's the application instructions, the call for proposals itself, the grant strategy of the program, then some frequently asked questions, and also the application form that needs to be completed is the one in the red format, final application form COVID-19. Then there are some other documents as well, such as options code for conduct, eligible and ineligible cost guidance, which will be very useful when you are developing your budget. And also the safeguarding policy checklist. So these are the contents of the application pack. So once you download it, you have everything that will guide you and help you prepare your application. All right, so I think Lawrence, that's it. Yeah, thank you.
Thank you so much, Emmanuel, for that. So aside this, we also provide you with additional information that would guide you through the preparation of your proposal. And then we've already stressed that applicants must not submit more than one application for this call. Only eligible costs can be covered by the grant, and then see the eligible and ineligible cost guide that is part of the application package that you have downloaded. It is in the applicant's interest to provide a realistic and cost-effective budget. Remember my admonition on the value for money. Always have that at the back of your mind. It is very important for prospective grant applicants to complete all sections of the application form. And these are three main sections, A, B, and C. What does section A entails? When you come to section A, and you have to pay attention to this. Section A talks about the application overview, the summary of grantee information, organization's background and additional information about the organization. There are a few due diligence questions that you need to supply information on, the reference or referees details, and then the bank and banking information. Take note of this, and take note that no section or no blank or box should be left unanswered or left blank. Under section B, we are basically looking at the key grant project information. We are looking at the project rationale, the purpose, and the activities that you wish to undertake to accomplish any of the areas that have been identified to benefit the targeted end users. We are also looking at the participation and evidence-based approach. That section, you will need to supply information that will indicate that the proposal development or the proposal that you have submitted to us has a full participation, and then the evidence that you would generate for the implementation of the project. The do no harm and safeguarding, you have to answer those questions, fill that in the application form. You have to also indicate how results will be measured. Tell us about the risk management practices or systems or strategies you have in place, the project work plan for this small grant that you are applying for, the project budget. And please take note that once you develop a project budget, you need to accompany it with a budget notes. Budget notes basically explains the lines items better for the information and understanding of the third party. We already explained to you that 15% of the total budget will be eligible or will be accepted as expenditure towards your overheads. So if you have line items like travels, and if one travel is administrative in nature and the other travel is program in nature, once we see travel in your budget, we will not be able to decipher which is administrative or which is overheads and which is a program or project in nature. It's only your budget knows that will provide that clarity to us. So take note of that. Under section C is just like you are wrapping up. That section is telling you that, can you go back and check the application form to be sure that you have filled in every required information. So the first subsection under section C is the application checklist that you will check. Okay, I've completed this section, then you take it or you check it. And then you also be looking at the organizational approval and contact details for the application. So here we are looking at the signatures that will be appended. It must be authorized signatories within the organizations. And also take note that the signatures will be our specimen signature going forward if you are selected as a grantee, that if any document is submitted to us, we'll match against to see whether these are the authorized signatories or not. And then also we would ask you or will require you to give us your email addresses, phone numbers, and then Skype IDs where applicable. And of course, the proposal must also be dated. Take note of the 3 sections and the relevant information that is required. That's why I spent much time here just explaining to you what is required under each section. The monitoring, evaluation, and learning of the program. Planning will be part of the application phase. Applicants will be asked to develop their project outcomes, objectives, activities, and indicators. We have already covered this in details in the preceding slides. So this is just like a summary for you. Monitoring would entail the collection of agreed data by the grantee on the progress against key performance indicators. That will be supported by site visits, and then the M&E group will tell you that data quality assurance. Then we'll also look at evaluation, regular reviews, and reporting points to check progress towards the outcomes that have been agreed. And then the learning part will inform the facilitated peer networks between the grantees, where grantees would support themselves at their own levels. There will be collaborative learning events at least once per year, or as the need may be. And then there will be knowledge products where relevant to share the knowledge that has been acquired through the implementation of the projects. And then we'll also be looking at learning questions at every meetings between the grantees and the program. And as indicated in this session, we would have a questions and answer session that will also be part of the learning questions that we envisage under the program. The grants also has a governance structure or system in place to give it the necessary integrity and transparency that it requires. So first, you have the grant team who will review your eligibility, assess your proposal, perform due diligence, and support and monitor the progress, as well as close out the grant. We would also have the senior leadership team who would provide a strategic review of the applications. They will recommend us to whether to award or not award. They will also be in charge of issues of fraud and safeguarding investigations. When we are done with this presentation and there is more time, I would plead with Laila to speak on some few issues of safeguarding so that all of us will be aware of what we expect. We also have the grants committee, which is the program's board that will set the strategic direction that will endorse the grants award and generally perform compliance oversight over the grants. And finally, we will have the endorsement of the donor in the selected grantees. What are the resources that are available? You've already been there to download your application package. Of course, when you go there, there are so many other guiding principles as to how options and the Ghana Somubi Dwumadie does or implements its projects, and the code of conduct that is expected of partners like you. Sorry. You can also get support from the grants at ghanasomubi.com when you send specific questions to us for addressing. Thank you, ladies and gentlemen. Time for questions, clarifications, contributions. Laila, back to you.
Lawrence, thank you very much. And I just want to acknowledge that this is Lawrence's first week on the program. So very impressive, and thank you for your hard work sharing all of that information today. If you stop sharing your screen, Lawrence, then we'll be able to see if anybody has their hand up for questions. Okay, I don't see any hands up immediately. So what I'll do is I will just answer some of the questions that came in the chat. We had 6 questions while your presentation was ongoing. And the first of these related to the buddy system, and it was asking what is a buddy system support initiative. So we're not saying, with any of the examples we gave of the kinds of things we would cover, we're not saying that you have to submit a proposal on one of those issues. We were just giving examples of the kinds of things that we would be interested in. But just by way of example, the buddy system is something that might be more suitable for healthcare staff than general community, but it's a kind of model whereby you allocate each staff member with a buddy or a colleague who is also a staff member, but they act in a way to support each other so that every member of staff has a sort of focused and specific person that they can reach out to if they're experiencing any difficulties with their well-being, their worries, if they're feeling overwhelmed. So that is the idea of a buddy system. So the second question was around whether projects that seek to establish counselling services for COVID-19 victims, whether they would qualify. And the answer is yes, they would qualify. I would only caveat that, it's implied in the question anyway, but that, you know, these need to be initiatives that support the mental health or mental well-being of the COVID-19 survivors. So, but as I said, because the question is talking about counselling initiatives, that's sort of implied. But yes, a program that does this would be eligible. And then there was a question about what are models of psychosocial support. So I think what we were trying to get at with this was just to find language which sums up all of the examples we had given previously. So buddy system, counseling, community chat lines, etc. So, but what we're really getting at when we're talking about psychosocial support is that we're looking more broadly than a purely psychological or a purely medical approach. We're looking at approaches which are participatory, which are community-based, and which are not purely health or medical focused. So things like the buddy system, things like circles of support, etc. Now I can see some hands coming up, so that's fantastic. I will get to you, but let me finish with the last three questions. So there was a question about which category of healthcare worker would be covered. Now this was from Albert. Albert, I wonder, could you explain the question a bit more? Because in principle, any healthcare worker, but I wonder if you were thinking something more behind your question. Is Albert on the line? He may have left. Albert, are you there?
Yes, I am there.
Oh, wonderful.
Good afternoon.
Good afternoon.
Yes. The rationale for my question is born out of the fact that they said healthcare workers and their families. So I was looking at, is it that those who have contracted the disease, COVID-19, or recovered, or just general health workers? That's what I was looking at.
Oh, I see. Thank you so much for the clarification. That really helps. So yes, we were thinking more that this is general healthcare workers. They don't have to be healthcare workers who have contracted COVID-19. So, but you know, it would be healthcare workers who are affected by it, as I'm sure that most are. But you know, because we're looking at solutions which really support people's mental well-being, we would expect you in your application to outline what the need is for the particular group that you want to support, and then how you would address that need. And I think also there was a related question which was asking about how do we deal with families when they have under 18s, because the program isn't supporting under 18s. So I want to just explain that point. So we're not supporting any projects which would seek to work specifically with children. So if, for example, you were designing a program where you're offering psychosocial support, play therapy, something like that, to children, one-on-one or in groups of children, we won't support it. And that's because at the moment our focus as a program is on adults. However, of course, if you're supporting healthcare workers, if you're supporting their communities and family more generally, then of course children within those families would benefit, and that's not a problem. But what we're talking about is saying that we won't support a project that focuses purely on individual work with children. And that's because to some extent we don't have the safeguards in place as a program to work with children at this point. So we wouldn't be able to adequately support that level of work. So hopefully that's clear, but obviously if you're working with individuals and their families, then of course their children will benefit too. And then the last question, and then I'll address some of the hands up, was a question around collaboration between disabled people's organizations and civil society organizations. So the question was really asking whether if you have a disabled people's organization which is perhaps unconstituted or lacks some of the formal structures, can it collaborate with civil society organization to submit an application? And the answer is absolutely yes. We would really support that. The only caveat we would put on that is to say that we would really expect the lead, so the CSO in that case, then to evidence that this is a genuine collaboration. So what we wouldn't want is for, I'm sure it won't happen, but what we wouldn't want is for any CSO to, if you like, write a DPO into the bid, but then actually they're not genuinely involved and it's more of a tokenistic effort in order to get the funding. But where there's a genuine collaboration and this is geared to supporting the DPO to access the grant, then we would absolutely support that. So I can see some hands up. I know Cynthia had a hand up earlier. Did you still have a question, Cynthia?
Hi, Laila. I just wanted to find out if questions are allowed after this session. Because sometimes, you know, once you get in the information right now, you're not able to see what questions are coming up. But when you get into the process of application, some things might come up. So just to know if we are allowed to ask more questions after this session and who would be the recipient of such questions. Thank you.
Thank you. And Cynthia, just remind me, which organization are you from?
I work with the Human Rights Advocacy Center.
Wonderful. Okay, so the answer is yes, absolutely. We're asking everybody to direct their questions to the email address we gave, grants@ghanasomubi.com. And the reason we're doing that is so that we can gather all questions, answer them, and then we'll put it on our website for everybody to be able to access. So we're looking at updating the frequently asked questions on a regular basis so that everybody has the same information available to them. So thank you for that question, Cynthia. Now, I can see also that David has his hand up. And David, maybe if you can introduce yourself and your organization and then ask your question.
Yeah, thank you. My name is David, working for the Presbyterian Community-Based Rehabilitation Program in Busa District. I'm kind of like looking at the background with regards to the legal policies and laws that you highlighted, the challenges where you talk about under-resource, limited budget, and non-enforcement. And then I'm looking at the whole the call, which is also looking at more talking about how does supporting persons with disabilities will help in addressing something like non-enforcement of the, let's say, the Disability Act.
So that's a great question. Thank you, David. So when we were giving the context at the beginning, really we were giving the context for the entire program. So we're a 4-year program across a range of issues with a focus, of course, on disability and mental health. That's our ultimate goal. And so we have a number of routes and activities, if you like, which together add up to the total program. And so this COVID call for proposals is a very small part of the whole. But for us, it's really about recognizing the fact that COVID is, well, we think really, and supported by information from WHO, causing an unprecedented increase in mental health issues. And so we feel that as a program with a focus on disability and mental health, this is something that we should seek to support with. So that's the background, but it's well spotted. So thank you for that, David. And then Dan, you have your hand up.
Hello, good afternoon.
Hi, Dan. Where are you from?
I'm from Mind Freedom, Ghana.
Welcome, Dan.
Thank you. My question has to do with partnership with organizations that can come together to apply this.
Mm-hmm.
Can any organization come together as a coalition and then on its own write a proposal? Is it possible to do that?
Can you explain what you mean? Do you mean submitting two proposals?
Yeah, what I mean is that can, let's say, 2 or 3 organizations come together to write, to apply, and then individual organizations too can do that on their own?
So in theory, yes, that is something that we allow across our entire grants program. However, if you were the lead on the, let's call it the partnership proposal, you wouldn't be eligible. Like, you can write
Say again, I'm not getting you. Say again.
Yes. So if you're the lead on the partnership proposal, and then you also submit your own proposal,
mm-hmm.
definitely only one of those would be successful. But if you're not the lead on the partnership and you write your own, then there is the possibility of being successful on both, in theory, and on our main grants. However, because this is a small grants round, and because we're looking at probably 3 to 5 successful projects at this point, we would probably be taking a strategic view that it wouldn't really be very fair to, in effect, have one organization benefiting twice from very limited resources.
Okay.
So I think it's a great question, and I wouldn't want that to prevent you going into partnership with somebody if that would be fruitful. But we would just encourage organizations to really reflect on their strongest bid and to put that in.
Okay.
Yeah.
Okay. Thank you.
Thank you too. And then we have Benjamin with his hand up as well.
Hello, good afternoon, everyone.
Hi, Benjamin.
Yeah. This is Benjamin from SWEP Foundation. I would like to know, our organization is a network organization that operates from about 16 districts. Now, I would like to know if we want to implement this, submit a project in, let's say, 1 or 2 districts. Will it be possible?
Yeah, another great question, Benjamin. Thank you. I think with a small grants round, focusing the efforts on 1 or 2 defined areas and then learning from that is absolutely the best way to go. So, because otherwise you'd be in a position of trying to spread quite limited resource very thinly across 16 districts. So we would definitely support you focusing on a specific area. We would want you to think hard about which area you're doing that in, because when we come to look at all of the proposals in front of us, we're definitely going to be considering their reach and where they're focused. So if we get 20 proposals in Accra, then clearly we're going to have to consider that, because we would want resource to be spread more equitably, you know, as need dictates. So hopefully that answered your question, Benjamin.
Yeah, and then also follow up. I read in one of the documents that the project does not support children. We focus on, or our target mainly is children between 0 to 18. However, we have parents that we have mobilized to form a group that we empower them. So in this case, can we use the parents as well in order to apply for this grant?
Yes, that's very interesting, Benjamin. So one of the reasons we're not supporting projects for under 18s is because as a new program in Ghana, we don't have the right structures in place yet to ensure that all projects and programs are working in a way that does no harm towards children. I'm sure that you have a lot more experience in this area, in fact, than we do if you work with under 18s regularly. So for this call for proposals, you would need to be targeting your group as being the adults, the parents. That would need to be your target.
Thank you very much for your explanation.
You're welcome. James, your hand is up.
Yes. Good afternoon, Laila and your team. Thanks for that elaborate presentation and explaining all the processes. I have 2 questions. One, does this course support infrastructure in relation to counseling, setting up counseling units? That's one. And the second question is on students in training, health training institutions. Does this support?
So infrastructure, it really depends what you're talking about. If you're talking about renting a building or setting up and filling up a completely new treatment unit, the answer would be no, it's excluded. But if as part of the delivery of the work, some small items of infrastructure and IT need to be purchased, then I would say that yes, you would put that in the budget, and then we would assess that as part of the overall presentation. Do you mind repeating your second question?
So the second question is on student health workers in training. So those in nursing schools, midwifery schools, and that category.
That's very interesting. So we're open to it, but we would need to see the evidence from your side about what makes them a group that is particularly affected by the sort of mental health stresses of COVID-19. Because the reason we selected healthcare workers as one of the target groups was because of the demands and pressures that they're under in dealing with an influx of patients, dealing with the PPE requirements, dealing with the fact that some of them are struggling to isolate themselves at home, and some are isolating themselves from their families. So really, you know, the impact on student healthcare workers isn't one that we as a program know a lot about. So we would be looking to you to really evidence that need, and then we would take it on board.
Right.
Okay.
Thank you very much.
Welcome. And then I have Kwame with a question.
Yes. Good afternoon.
Good afternoon.
Yes. I want to find out, you made mention that organizations or people can send questions for clarification, and you compile these questions and you answer them and put them on the website. I want to know if there is any timelines for the receiving of questions, and when should organization go to the website for responses?
Yeah, it's a good question, and maybe we've put ourselves under some pressure with that because of the short application window. So just to clarify what I was saying earlier, we would reply to the questioner direct, but we would also put it on the website by updating the frequently asked questions. So it's not that the questioner is going to have to wait for some extended period, but what we're saying is that all questions will be compiled and also added to the website so that anyone can see them. And we would envisage doing that every 2 or 3 days.
Okay.
Yeah, hopefully that. Sorry if I confused it earlier.
Oh, that's
all right. I saw another hand and I think it's gone. Somebody had their hand up. Yes, Cobby Blay.
Okay, hi, thank you. So I have been wondering about, there are generally some people who have who have developed some level of anxiety, some even developing some sort of panic attack, just by the news, just by what is happening and all that. Are these targets part of it, since they necessarily may not have been infected with COVID, but they could be going through some sort of psychological disturbances owing to the news of it, or the fact that they even have some battling with. And so is this group possibly targeted, or could be targeted, I mean, to provide that psychosocial support under this project? And I say this out of the fact that personally been providing some sort of psychological interventions for these people. There are some who will call you that, okay, they are living with diabetes, but they are scared of being infected, so they have avoided certain activities entirely. Some are also having some different diseases, immune related, so immunosuppressive illnesses. And so because of that, they are not meeting with family at all. They are not, I mean, they've entirely been away from every social activities and even stopped working together. I'm wondering whether this group have any consideration under this project?
The easy answer is yes. That is absolutely a target group. We've talked about healthcare workers quite a lot, but as I mentioned, our overall program goal is about disability and mental health. So anyone with, say, a health condition or an existing disability who is experiencing sort of extra and additional issues and mental well-being problems as a result of COVID or as a result of the COVID restrictions, then yes, absolutely, they would be a target under this program. And thank you for explaining so clearly about how COVID can really affect these kinds of people. It's so important to highlight that.
All right.
Thank you. Okay, so there's a question about when approved projects would kickstart and when they would end. So just to briefly give you the timelines, closing date for the call for proposals is the, I've completely forgotten, the 14th of August, is that right? I had a sudden mind blank. And then we will be assessing internally. The grants team will be checking eligibility. They will be doing an initial assessment. Then it will go to the senior team for a strategic review. And then the program board, who have a grants committee function, they will be meeting on the 1st of September. And at that point, they will be approving or making changes to the recommended list of grantees. And then subsequent to that, it goes to the donor for final endorsement. And it also, then the provisionally approved grantees will undergo due diligence. So we are looking to be able to disperse funds by the end of September, and for projects to start immediately thereafter. So in October for up to 12 months. Now, you may put in a proposal which is shorter than 12 months, and that's okay. But as Lawrence ably pointed out in the presentation earlier, we will be looking at value for money. So you'll just need to consider that in your application and your budgeting. Now, are there other hands up? Otherwise, there are some more written questions which I can quickly address. I see some people are off silent, so if you want to ask a question, please just speak up, that's fine.
Thank you very much, Laila. I'm Abuedu. I joined in very, very late. I'm sorry. I want to find out if the recording will be available to us so we can at least follow whatever had transpired already.
Yes, thank you. So we do intend to make the recording available. It's our first time of recording a Zoom meeting, so we'll have to deal with the technicalities of locating the recording and then adding it to our website. But the intention is to make the recording available, and definitely the presentation that we gave at the beginning will be available as well. So thank you for asking. Thank you. So there's some more questions in the chat here. So there's a question about whether we'll support capital equipment. And I think, as I mentioned earlier, I think it was to James, it really depends on what you're talking about. If you're talking about a building, the answer is no. If you're talking about some IT equipment to facilitate the project, then yes, and we would look at the budget associated with that. And then there's a question about whether a project is targeting a specific geographical area or anywhere in the country. So in the future, some of our calls for proposals may target specific areas. But for this call for proposals, we're not targeting any specific area. And so anywhere in the country will be considered. And of course, it's up to the applicant to demonstrate why the particular location or geographical area that they're proposing is relevant to the call. And then there's another question about the % of funding that will go to admin costs and remunerations. So we're happy for up to 15% of the grant to go towards operational overheads. And then the remainder should be project costs. And then there's a question here about whether all applicants will be notified of the final decision on their application. Well, I'm going to say yes for this call, and if we get 1,000 applicants, then I might regret that. But for now, I think hopefully we'll be in a position to respond to everybody. But in the future, we might have to say that if people don't hear from us, then they weren't successful. But for this call, we're expecting to give everybody the information directly. And then there's a question about how many rounds we're expecting in the future. We haven't actually specified that yet. We're still adapting and finalizing the grant strategy. It was launched yesterday, and we're open for further refinement on that. But we're expecting probably 3 to 4 rounds of grants across different thematic areas over the next 3 to 4 years. But maybe we'll do some more. We'll see how we get on. Okay. I'm hoping that I've managed to reach all of the questions in the chat, and I'm hoping I've seen everyone who had their hands up. But if there's a question that you asked that wasn't answered, or if there's a question that you really want to ask, please go ahead, because we have the time available. We're here to answer your questions today. Or if anything that was presented wasn't clear or you want further information, please just go ahead. Normally at this point, somebody comes in with one last comment or one last question. Nothing further? Okay. What I'll do then, just briefly before wrapping up, is I will emphasize, as Lawrence kindly asked me to, safeguarding and our expectations on this call for proposals. So you'll see in your application packs, when you download them, that there is a safeguarding policy checklist. And we will be expecting you to review the checklist and to review your safeguarding policy and to ensure that it meets the criteria that we're indicating. It's not a hugely complicated checklist. It does just cover the basics. It's our minimum standard. Now, if you're an organization that doesn't yet have a safeguarding policy in place, let us know and we can have a conversation about that. We may be able to support organizations to put a written policy in place if they're already managing safeguarding in an effective way. But if you're not managing safeguarding risks at all, or you haven't considered them, then for this program, because it's dealing with mental health and psychosocial support, we may not be able to fund you. But have a look at the criteria first, because I'm sure many organizations working in this field will find that they are doing the right thing. They just perhaps haven't written it down yet. And that's okay. We're available to support if that's the case. But if you're really not dealing with safeguarding at all, then probably this isn't the program for you, but there would be future grants calls going forward where we're able to offer more capacity building support. So I hope that's clear. I'm going to pause one last time to see if there are any further questions. I'm not seeing any hands up. I'm not seeing any more in the chat. So
I have one more question.
I knew it. Wonderful. Who is that?
That is Dan.
Dan, let's hear from you. Thank you.
Well, my question is on the chat, so you can read it out. Yeah.
So this is about the recorded presentation.
Yeah.
I was late to the meeting,
I was very late to the meeting.
Missed the presentation. Please send us the recorded presentation.
Yes, we certainly will. Subject to any technical difficulties at our end. I'm promising it. Our intent is to do it, but it's my first time dealing with recording a Zoom meeting. So we will definitely be intending to do that. And then a question from Benjamin in the chat asking if counterpart funding is required. So it's not required. We've called it match funding. You're calling it counterpart funding. We're talking about the same thing, and it is not required. If you have it, fine, mention it, but it's not a specific requirement of this call for proposals. Okay, so it seems like we've covered all of the questions. And Lawrence, did you have any final comments to make before we wrap up?
Yes, just some a small point that as indicated by you, if you have any questions to ask, you can send them to the email that is in the application package. That is the grants at Somubi.com. So that we would respond to it appropriately, and thereafter share the same response online for all other prospective applicants to read for their own information needs. That's all.
Thank you so much. So with that, I really hope that you found it useful and informative, and that it really will help shape your proposals and applications. I want to thank everybody who has made it to the session today. It's really great to, as I said at the start, to see some familiar names, some new names, and we're really looking forward to receiving some good, strong proposals from you, and we're really hoping to establish, some great collaborative working relationships with the organizations who apply. And even if you're not successful in this grants round, we're having future grants rounds, and we're a 4-year program, so we're very much hoping to build collaborative relationships across the whole period of our program as well. So thank you very much. As Lawrence said, if further questions come up, you can send them to us at grants@ghanasomubi.com, and we will answer those as quickly as we can. So good luck with your applications, and I'm really looking forward to seeing those come through. And if I can just particularly thank Lawrence for his presentation, and also Emmanuel for supporting with that. And thank you to everybody who's attended today. Okay. And have a lovely rest of the day and evening. Thank you. Bye.
Thank you.
All right.
Bye.
Thank you, Laila, and thank you, Lawrence.
Thank you.
Thank you.
Thank you.
So thank you, everybody. Laila, teacher here. Wonderful
Hi,
session.
Peter. Thank you.
Thank you.
Thank you.
Thank you.